Hi, and welcome to another episode of Every Possible Angle. I'm very excited today to be joined by Nathan Fine, Manager of Organ Utilization at Donor Network of Arizona. Welcome to the show.
Such a privilege to be here, Michael.
Thank you so much for joining. I think today we're going to learn a lot more about the role of organ procurement organizations and how they affect all of transplant and all of organ donation. So, maybe to start with, can you introduce a little bit about Donor Network of Arizona?
Absolutely. So, Donor Network of Arizona is the federally designated organ procurement organization. It's our privilege to serve the entire state of Arizona. There are 55 OPOs in the United States currently. Some states do have more than one, but we are proud to serve the entire state of Arizona. Our mission every day is to make the most of life through the gift of organ and tissue donation.
And it's truly it's incredible the role OPOs play in this process. I mean, uh, from everything to educating the public in your region about organ donation to facilitating the donation process, which has to be incredibly challenging. It's a field I think most people might not know about. How did you end up getting into organ procurement?
So that's a great point because I've worked in healthcare in one capacity or another for over 20 years and started my work in healthcare as an emergency room tech back in East Tennessee, where I grew up. And even, 5 to 10 years in the emergency department, I never really knew that this field of medicine existed. Of course, we realize organ transplantation happens every day, but I never really thought about how that's facilitated. I'm a registered nurse, but I did kind of take a break back in the day and worked as a flight attendant for a little while. And so one day I found myself in the flight deck with a first officer, and we were talking about, the work we had done prior to the airline. And turns out she had been an organ preservationist before she was a pilot,
Really?
and actually really planted that seed for me to look into the OPO world. And as they say, the rest is history. And I have found something that I'm just truly passionate about, and I'm very grateful for that kind of happenstance to get into this work.
I love that. It's just such a precise origin story moment. And so when you first then went to learn more about this world and join an OPO, where did you start and how did you get to where you are now?
Yeah, so I started working in tissue recovery
Hmm.
at Donor Network of Arizona. That was back in 2015 or so. And so worked in tissue procurement um, at that time. And prior to that role, I never really knew the impact of that work, that one tissue donor can improve the lives of 50, 75, 100 people sometimes.
Incredible.
And so that was my first role in the OPO. Um, Again, by happenstance, I later became a tissue recipient
Mm.
and had two bone grafts to save one of my teeth.
Wow.
So
Yeah.
brought that kind of full circle. But I did move over to Northern California and began my work in organ allocation or placement,
Hmm.
how organs are matched with recipients.
Hmm.
And that really has led me down the path that I'm on today.
Wow. I mean, and it's truly incredible the work organ procurement organizations do, um, because you're right. It's not something that people see every day, but so critical. And we've had plenty of people on the podcast that have been organ recipients and have had their lives transformed because of this. Um, Although I have to imagine, working on the donor side of things, it can be very emotionally challenging. It's dealing with death, dealing with people in a very stressful, one of the hardest points in life, um, has such an incredible positive impact. Uh, how does that affect the people who work at OPOs? Is that a challenge? Is that how does that constant experience of working in this field affect you?
I think it's so important in the OPO world that we take care of each other.
Hmm.
Um, our talented teams every day are encountering a donor family member that is having the worst day of their life. And so to encounter that on a daily basis, we're really making sure that we care for ourselves as well through
I
that process.
mean, that's got to be incredibly taxing.
It is, and for our teams that speak with families, they have a wealth of knowledge, especially chaplaincy background, social work, other backgrounds that really help them
Mhm.
and with their life experiences to connect with families in that moment. For those of us on the clinical side,
Mhm.
um, it is you see uh, very tragic stories, and you see these on a daily basis, and so any amount of connect to purpose that we can do as a team and remind each other of the true impact of our work is very powerful. On the OPO side, I feel like we don't always we see patient names and a transplant center on a match run, but we really don't know their stories, and we later on may see that that patient's alive and that the graft is functioning, but we really never know what happens to those patients. After I became a registered nurse, I actually got the opportunity to move over to the recipient side for a couple of years as a nurse coordinator in liver transplant. And I got to see the other side. I got to see through the curtain. And I would not give anything for that perspective. Um, Very powerful to see. I had a patient who did not realize she had liver disease, ended up on a ventilator, sedated, and actually was status 1A, received national priority for liver transplant. And she woke up to learn that she had had a liver transplant
That's incredible.
and to follow her, see her in clinic. I got to watch her get engaged. I watched her get a new job. I got to see, her look toward building a family and moving on with life. And so it really uh, brought this full circle for me
Yeah,
in a very powerful way.
and I think that exactly that connection to mission, to be able to see that firsthand must be really helpful to drive you in your role and to your role in terms of organ utilization. Um, it's so critical to make sure, having seen how impactful organ donation is, to make sure every potential organ can go to use. I mean, I have to imagine that experience must really, really help you in that.
It really does. And over the past year and a half or so that I've been in my new role, um, I've I've gained so much perspective, and I really, along with some very talented team members in our organization, we really think about making the most of every opportunity.
Hmm.
Donors and their families entrust us to do that every day, and it is not something that we take lightly. And so I think it empowers us to get into a rule in mentality of pushing boundaries. What is possible today that was not possible yesterday? Um, and we are seeing the impact of that on a daily basis.
Could you tell me a little bit about some of the initiatives that Donor Network of Arizona is working on to improve? And so, actually, just to start with, we talk about generally it's five major organs that could be donated, but not not every person who wants to be a donor or family who wants to do donation. Sometimes it's quite passionate for the family in that moment to make something good of the experience, and um, but it can be challenging to make sure all the organs are used. Can you tell us a little bit about that, about why it's challenging and uh, then what are some of the things that you're working on to help make sure every organ can get utilized?
I am very proud to work with wonderful leaders in our organization that support us in these endeavors to make the most of every opportunity. Um, I'm coming up on my 10th year in transplant, and we've seen so much change, especially in the last few years. Increases in donation after circulatory death, more medically complex donors. Um, Positive infectious disease such as hepatitis C, um, for patients who may be hepatitis C negative but are willing to accept a hepatitis C positive donor
Hmm.
organ. As the treatments for Hep C have evolved, there's greater than a 90% success rate in treating and curing
Hmm.
the disease in those patients, and so that can be a lifeline to get more patients transplanted and transplanted quicker. Um, HIV positive to HIV positive recipient transplants are another. But in terms of our organizational initiatives, one big one in the last year has been our normothermic regional perfusion program and making that an OPO driven offering. We've seen NRP, of course, in the United States since around 2020, really in a transplant center driven model. As heart transplant teams, especially, have seen the utility of using NRP. Um, and really, in Europe, we've seen it used 10, 15, up to 20 years with some pretty incredible outcomes.
Hmm.
So, as an organization, we looked at the use of NRP and some of the amazing impact it can have, especially for DCD livers, in reducing complications in those recipients, such as graft failure, delayed graft function, biliary complications, and seeing both an increase in quality of organs being available to those on the wait list, but the quantity
Yeah.
as well. And so we have made that an OPO driven program and are really doing NRP on all of our DCD donors now with some pretty amazing impact.
I mean, that's really incredible that, I think this one therapy that can be applied to the donor recovery can help with the placement of every organ and the viability and the outcomes of every organ. I think that approach, was a bit novel. Only a few OPOs have really taken this approach. Like you said, it started really as a transplant center
Mhm.
driven decision, uh, but that can be challenging when one center wants to. I think one of the surprising things I found when I joined transplant was, you know, normally in a one OR is only people from that institution. Now you have potentially people from several different representing several different institutions all coming into the same OR to recover organs and bring them back to their home institutions. And the strategies taken have to sort of be aligned to have the OPO who's responsible for the donor make that choice. Feels like it can really ensure as much utilization of all of the organs as possible, which I thought is really unique. How, in terms of a new initiative like that, what uh, organizational buy was it challenging to drive this change and this philosophy change, both within your organization and also with your partner transplant centers?
I think it was definitely a philosophical shift, as you mentioned, that to take that from a transplant center driven process and make that the OPO's decision. And we've really made for abdominal organs NRP the standard of care from our donors. Transplant centers, especially for the liver, they may choose to use machine preservation devices or um, other techniques related to recovery, but NRP both benefits further their recipient and the recipient of the kidneys, pancreas as well, um, but really insulates us from the risk if we enter the operating room and that organ's declined by the primary center. This really gives us a major tool in our toolbox to shield us from non-use of that organ as much as possible. And we've really seen on multiple occasions, if it were not for NRP in that moment, the organ would have gone to waste.
That's incredible. And I love hearing like that about change leadership. That's always challenging to bring new paradigms, and it's wonderful that you're doing this and making such an impact. I think another big change that's been certainly affecting the space. Allocation has changed a lot in the last 7 years. Uh, with some I think uh, arguably great impacts towards making sure the most medically urgent patients get the right organs. But it does mean that the matching is much more complex, potentially over much bigger geographies, potentially with many more transplant centers than you potentially had to work with to match in the past. How has that affected the work of the OPO?
It's been fascinating, especially with the use of NRP, as we work with more transplant centers who are further away, more complex logistics. We're seeing a lot of mixing and matching of
Mhm.
preservation modalities. Kind of refer to it as NRP plus. It's
Yeah.
not just NRP. We may have uh, NRP perfusion of the organ followed by placement in a device such as Paragonix Liver Guard, followed by machine preservation by the transplant center, either in the donor OR or
Mm,
back to base model at the transplant
yeah.
center. And so, really seeing how those modalities coming together can lead to very successful transplantation with longer cold ischemic times and, like you said, benefit patients in other areas of the country.
With kidneys, the highest volume, dramatically more so than all the other organs. How does kidney transplantation differ from and donation differ from all the other organs?
Sure. As of a few minutes ago, nationally, there were over 104,000 patients on the national waiting list, and over 90,000 of those were waiting for a kidney. Kidney donation is one of the more uh, frequent donations from a deceased donor. Um, they are the most resilient in
Mhm,
terms of acceptable cold ischemic times,
mhm,
especially with machine preservation.
mm,
Cold times of 24 to 36 hours or longer
mhm,
can be possible in kidney, but they're very vulnerable to logistical difficulties.
mhm,
Um, After 9/11, we saw previously kidneys would perhaps ride in the cabin on a commercial flight, maybe in the flight deck. And after 9/11, for security reasons, those were really uh, placed into cargo holds.
mhm,
And so through the pandemic, that was incredibly challenging as
mm,
airline cargo offices had very restrictive hours.
mhm,
That thankfully has improved pretty dramatically, but there are still, flights that take off, especially through the night over the weekend that aren't possible to utilize cargo for. So at Donor Network of Arizona, I'm very proud of one of our initiatives to begin utilizing an onboard courier for kidneys moving around the nation. And we've seen that on multiple occasions shave off 8, 9, 10 hours of cold ischemic time and really add a layer of safety compared to kidneys that may encounter delays, may not be loaded or offloaded from airline cargo, and really add a layer of safety, especially if there's a decline of the kidney while it's en route. Having that person there, keeping the kidney safe and accounted for, and can move in a different direction in the country if they need to. And so, um, with those logistical vulnerabilities, tools such as Paragonix KidneyVault have really allowed us to open more doors and get more kidneys to transplant that may have been declined by transplant centers.
I think it just speaks to how complex this field is. It's it medicine is normally surgery is within four walls, right? That you have to worry about it. But this is a whole field that requires complex logistics for multiple organs going in different directions, and having that layer of safety. I applaud the initiative you have there, because like you said, things happen. There's reasons patients suddenly go unstable. You have to reroute, and reallocate. By having someone with a guardian with the kidney, you can redirect, and if you also have additional time, make sure that kidney gets to a recipient who can take advantage of
Yes, and as I'm speaking here
it.
with you, we have a kidney that is on a Paragonix KidneyVault device, and has just encountered a flight delay of about 3 hours. And so being able to redirect the attendant to another flight routing, let's fly to another city, and drive as necessary to the transplant center, is really decreasing cold ischemic time, decreasing that risk of delayed graft function in the recipient. And so, even while we're speaking,
It's a real thing,
this is working in
This
our
is,
favor.
I first met you was around your one of your first cases with the Paragonix Kidney Vault system, which was the world's first donor kidney to fly on a commercial aircraft while being continuously perfused. Can you tell us a little bit about that case and what impact that makes for your role?
That was an incredible case. Um, we had a medically complex DCD donor,
Hmm.
a gentleman in his late 60s. Um, the kidneys were recovered with reasonable biopsy results, reasonable lab values, some difficult anatomy, but those kidneys were refused by all transplant centers within 250 nautical miles of us, and multiple national centers as well. So hundreds of candidates had declined that organ. We spoke to a transplant center in Texas who expressed interest in the organ, but realized that based on flight times the next morning, the kidney would arrive around the time they should be doing a liver transplant. And so the ability to perfuse the kidney throughout its journey, and continue that to the transplant center, gave them the ability to mitigate the risk and manage the cold ischemic time uh, better. But this happened to be within days of our Kidney Vault devices arriving to our OPO. Um, the Paragonix team was in Arizona to assist us as the fifth OPO in the country to utilize Kidney Vault. And so in that moment, we didn't realize how impactful that case was going to be.
Hmm.
But it was a team effort through the middle of the night from,
Hmm.
say, 1 a.m. to about 5, 6 in the morning when that kidney left our doors. But there is a recipient today grateful uh, for that gift of life. And again, the Kidney Vault really allowed the transplant center to safely and effectively transplant that kidney,
Yeah,
and with no dialysis required in the first week
fantastic. That's
after
great to hear.
transplant. And so, realizing later that this was the first to travel for transplant on a commercial flight was a great thing for us to celebrate. But more specifically, in this case, um, that kidney ended up being the only organ to make it to transplant from that donor. And so we think a lot about the impact on donor families when we recover organs for transplantation, go to the operating room with their loved one, and we're entrusted with that gift. And if circumstances lead to no organ making it to transplant, that's difficult for our team, but that can be heartbreaking for the donor's family. And so, to prevent what we refer to as a zero organ donor in the process of all of this was just an absolute highlight. And we were thrilled with that outcome for the donor and their family.
That's so incredible to hear, and it's so wonderful. And It's also amazing, we hear more and more about this with tools to then create time between the donation and the transplant. More things are possible. Like you said, that in this case, when one transplant is happening, historically or is scheduled to happen, you have this choice: do I do this patient
Right.
transplant or this patient's transplant? And it's a zero sum game, but you can create enough time. It's amazing to be able to treat both patients and provide them both with transplantation.
Exactly. Just that extra layer of safety and layer of capability for our transplant center partners to transplant more patients and transplant them well.
Absolutely. And then, so you've continued to use KidneyVault. Has that affected how you approach and what kind of centers and situations you look at placing organs?
We have. We are early in the process. We've utilized 10 to 15 or so
Yeah.
kidney vaults. We, at the time of this taping, have one in the airport right now boarding a flight.
Which
Um,
wonderful to hear.
yes. But it's really, in the short amount of time, made an impact, especially for transplant centers in rural areas that have logistical complications
Hmm.
in getting organs to their facility. And so we've had two kidneys go to a rural area with flying to an alternate airport and driving to that facility. And we've heard from one of those surgeons in particular that said his patients commonly had delayed graft function just because of the longer cold ischemic times that they would usually face.
Hmm.
And that with transplanting the kidney that arrived on KidneyVault and continued to perfuse, the kidney worked well right out of the operating room, and the patient did better than he would expect in, the situations that they would routinely find themselves in. And so we're learning every day more about the utility, and collaborating and educating with our transplant center partners that, you know, don't consider the cold time as you normally would. Let's talk about the resources that we have available now, and give you more ability to accept the offer for your waiting patient.
Which, uh, so many things there I'd love to talk about. I mean, for one, uh, you know, I think this is an important comment, and I think it's particularly true in kidney because there are so many more kidney transplant centers. They aren't, and I think it's wonderful that their patients have access closer to their homes, closer to their communities, rather than have to displace themselves for transplantation. But to get organs to them is that much more can be that much more challenging. Um, but to be able to support those communities is incredibly, I think, important for us as a community to find the tools to do so. But I think similarly related to that, the piece that you talked about, um, so much is changing right now to the paradigms that a receiving institution may assume about what they can accept may not be informed by some of the tools that your OPO has. How do you go about educating and building relationships to help create that awareness that you can get a kidney to that rural center?
I think we do a lot of real-time education as
Yeah.
much as possible, during the allocation process, especially for kidney transplant centers that may have candidates that are highly sensitized, very difficult to match, very needle in a haystack, one in a million type offers that these patients may receive and get national priority for, or be, a very uh, a close match, a zero antigen mismatch, for example. We especially want to do everything we can to give every possible advantage to those patients with priority and a lot at stake.
Hmm.
So a lot of real-time education from our allocation team, our organ recovery coordinators speaking with transplant centers, but also in my role and others in our organization reaching out for more proactive conversations with transplant centers as we see through things like continuous distribution, especially for lung, as we look to see that expand to other organs, what conversations can we have on Tuesday at noon rather than Sunday morning at 2 a.m.
Yeah.
to talk about those logistical barriers,
Hmm.
especially for liver with our use of normothermic regional perfusion. We had a conversation at a transplantation conference with a center out in the Midwest who really thought, Arizona's too far, especially for liver. Um, we're not going to be able to mitigate the cold ischemic time very well. But in having those conversations in advance, when that transplant center did receive an offer from us, um, were able to accept that first liver from us in years and realize, this is more possible, especially now with NRP and tools such as LiverGuard. Adding that extra barrier of safety has really, that's just one example of a transplant center who has been able to uh, transplant an organ from us that they really wouldn't have considered in the past.
That's I think that's incredible, and it makes I think every time I dig into it and with different people, it's interesting how the combination, and this is I think one of the really unique things in this space is the importance of the community because what we find is the combination of tools with processes with the people involved, relationships with the transplant centers. It's really important to have those contacts and those abilities to work together because we can find new solutions. I think even as we talk about new policies with the right tools and the right approach and educating people on what is now possible, we can address some of the challenges facing the space. And one of the challenges in the space is there's never enough organs. We always want to grow. But congratulations, Donor Network of Arizona had a record year last year. You had 371 organ donors and saved more than 899 lives. That is incredible work. Impacts so many people, both donor families who it's really important for them to donate, and then to be entrusted with this role and this gift, and all of those recipients who critically needed an organ. Incredible work. Congratulations.
Thank you very much. We're very proud and celebrate those outcomes. And particularly striking for us was that we also had 1,050 organs transplanted from those donors in 2024. I love to say we've got that comma in there. And so um, it's we want to make the most every day and push ourselves um, to always find new and creative ways to get more organs transplanted. And so the impact of that work is just phenomenal.
And so, are there any goals for 2025, or what's is it to keep growing, keep saving more lives, and increase the number?
We, in looking at some of our data, since 2015, we've seen a 224% increase in organ donation in the
That
state
is
of
incredible.
Arizona. And so we always look for ways to keep improving.
Yeah.
And so uh, much of our same initiatives are rolling into 2025. We have grown our teams pretty exponentially. We're up over 360 team members proudly serving our organization. And so some initiatives such as stronger work in referral monitoring and referral optimization to help us uh, work with our hospital partners to make sure that donation opportunities aren't missed.
Hmm.
Um, Looking to continue our NRP program and initiatives such as the consignment of Paragonix devices to really have as many tools in our toolbox to prevent non-use and get more organs transplanted. So um, keeping just all of our team members focused on our life-saving mission um, is our continued goal.
Well, those are incredible goals for 2025. It's great work you're doing, and we're also a mission driven group. Even one of the lead engineers for our KidneyVault system, his mother is a kidney transplant recipient. He was very passionate to be on that project and make this program a reality. And so, I'd love for our own team know how you see preservation being able to help you achieve those goals. How can tools like the Paragonix systems enable OPOs to do what you're doing?
Absolutely. I in 2024 we saw organs transplanted that we may not have even offered in the past.
Hmm.
Things like more medically complex donors, DCD donors, the use of NRP. Uh, we've seen organs that, even 6, 8 months ago, we wouldn't have seen transplanted. So I think our use of NRP in Arizona, combined with transplant centers that may wish to use machine preservation, especially for the liver, um, either in our donor operating room or in a back to base model. But devices from Paragonix, especially the liver guard device, having that tool in our toolbox is really the difference sometimes between an organ going to waste and an organ being successfully transplanted. Just one example, we had a donor in Arizona a while back, a medically complex donor, DCD donor, a gentleman in his late 60s, that we had offered the liver for transplant, and we worked through the entire match run, which ended up being 39 transplant centers across the nation, and that equaled 2,239 candidates that liver
Wow.
was refused for.
Wow.
And so after the liver was refused nationally, having LiverGuard available at our OPO at a moment's notice, our use of NRP, we went back to one of the transplant centers who had refused the offer and asked them, with these additional tools at our disposal, would you reconsider this liver? And reconsider they did. And that liver ended up being transplanted and traveling about 1,700 miles from the donor. So that was really a liver, again, 6, 8, 12 months ago, we would not have seen transplanted.
And can I ask you, is it normal to send livers that far? Is the majority of your livers going across the country?
They are not.
Okay.
They are not really. Prior to machine preservation, prior to devices like LiverGuard, we really saw livers traveling in our region,
Yeah.
500 to 1,000 miles, maybe.
Yeah.
But now, we see livers traveling to New York, to Florida, to Ohio, from Arizona, um, other states in between um, that we would not have seen
Absolutely.
in years past.
And I think this is all goes to speak sort of the challenges of finding the right organ for the right patient at that right moment. There are all of these challenges, logistic, the like we spoke about, the availability of ORs, availability of the team, and yeah, I think this is one of the things we're passionate about is what we're really seeing is by having the time to do this work and do this work well and meticulously, like you've described, hopefully more patients can get the organs they need.
Absolutely. We are really able to pursue more donation opportunities than we have in the past. We have, whether that be hospital or donor family time constraints, you know, at the point that we may approach a family with their loved one's decision or their opportunity to make that decision on their loved one's behalf. Families may be incredibly exhausted, may have been at that patient's bedside for days or weeks. and really not be able to offer that time to us. And so we are able now to uh, pursue more of those opportunities with extreme time constraints, and that's only improving. And that's really a mind shift for our teams of what is possible today was not possible yesterday. And the same goes for very incredibly unstable donors that may not be able to be stabilized adequately to make it to the operating room. And so being able to recover those organs, utilize those tools, and get more to transplant is phenomenal.
And again, it's sort of coming back to what we spoke about earlier about mindset shifts around what's possible about instituting new change and really educating the community about how rapidly things are evolving. And I think it's exciting to work with innovators and people who can continually look to ways we can continue to improve this field to get better outcomes for recipients and make this impact for both donor families and recipients. So, uh, absolutely appreciate everything that you all are doing.
Absolutely, and Paragonix is a wonderful partner to us
Hmm.
in this work. Um, every member of the team has had that mission driven spirit
Hmm.
in my interactions with them, and I will call at 2 a.m. with a off the wall request, and the answer has always been get the organ transplanted, take care of the paperwork, the those little things later, get the organ, and we appreciate that.
And I think absolutely throughout the organization that is something we're passionate about, and I think it's something like you say, it's something that if you're in this field, you need to have that passion. You need to really understand the mission and the purpose, because like everything, it can be challenging. To break down barriers of what's possible is not always easy to do. So, yeah, we always love the challenge, but it's fantastic to do it with great partners.
Yes, and I think for us in our work, it's easy to get tunnel vision, right?
Right?
And
Yeah,
forget the true impact we're making every day.
absolutely.
So any opportunity that we have to share outcomes with our staff or do connect to purpose opportunities, meet donor families, meet recipients, and hear their stories really grounds us in our work.
Absolutely, and for our team today, you came and joined us in our offices. We everyone appreciate that, and every time somebody comes from a different facet of the field, that's partly why we do this. Is to make sure we all understand all the different facets, whether it's on the transplant side or the OPO side or the donor family side or the recipient family side about how this impacts all of the different stakeholders in the space, so we can keep our eye on the mission and the goal.
Absolutely.
I've really enjoyed getting to know you in the last few months, and even at conferences, seeing the community you and network you have in the space, and the initiatives and innovation you and Donor Network of Arizona are bringing forth. I'm curious for if you were talking to you 10 years ago, getting into transplant, to the young people who are joining the transplant space, what advice would you give them about this field? It's an incredible field. It's also a challenging field. Any thoughts you would have?
So funny. This is some of the most challenging, but some of the most powerful work you could ever do.
Hmm.
And there are so many ways to be involved in organ procurement and transplantation, whether that be nursing backgrounds, technical backgrounds, um, other ancillary groups within our organization. For those that may not wish to be at the bedside or in a clinical space, there are so many opportunities within our organization. And without each of those roles, this process stops.
It's true.
And so I think um, when I got into, especially into organ allocation and placement, I had the privilege to work with a group that had the highest attention to detail, the highest standards, looking out for anything in our work that could impact safety of a recipient. And I didn't realize how valuable that was at the time. And so I try my best in my work to always pass that gift along, to show how uh, little actions can make such a big difference for a waiting recipient. And so um, this is incredible work. We often, will share with people who are interviewing with us or are starting their journey. We look for uh, people that have the passion and the drive and can be all in to our mission. And that really leads us to have great tenure in our organization, 10, 15, 20, 30 years of making a difference for others. So that is incredible. The other thing I love about the OPO community is we share a lot. We have a shared mission to save more lives. And so some of the most collaborative leaders and others at other OPOs, we share best practices. We share with one another how to solve problems and how to do new things. And because that's at the end of the day, that's what's important for
Hmm.
us. It's not only how our organization performs, but how the transplant system as a whole
Yeah.
is going to perform.
And it's, I think with more national sharing, it's only getting more interconnected and more interdependent. And I couldn't agree with you more. And I also love what you said. I mean, it's true. Those kernels of wisdom you learn from your mentors, for a period in your career, you sort of don't realize how much you've internalized them, and then you get to this moment where you're sharing them on to others and passing them down to others, and you realize how much of an impact they've made to your career, and how important it is to pass that on to others. And I love that thought.
Absolutely.
Well, thank you so much for the conversation today, and all of your time. Are there any events or initiatives or conferences that you'd like to highlight?
Well, sure. We look forward to seeing a lot of our colleagues at the Association of Organ Procurement Organizations conference this summer. We work a lot with the Alliance, which brings together both OPO and transplant center professionals to network and connect on key issues. But we do a lot of work in our community. Each and every week, there's always something going on that our teams are looking to be involved in. Uh, in the summer, we always enjoy Donate Life Day at the Arizona Diamondbacks. I don't know a lot about baseball, but organ donation I can speak about with our community. But our donation symposium is in the fall where we bring our hospital partners really to engage on how we work better with them and receive more referrals from them. And we do a lot of work, especially in Arizona. We have a big Native American community in our state. And so we have team members that especially enjoy going to events in the Native American community to talk about the impact of both donation and transplantation.
Yeah,
Um,
wonderful.
and so those are always great for us. So we keep busy all throughout the year.
That is absolutely wonderful. And again, thank you for all the work you and Donor Network of Arizona does day in and day out. It's truly hard work, challenging work, but so impactful and so critical for transplantation. And thank you again for coming today. We loved having you.
It was a privilege, Michael. Thank you very much.
Thank you. And thank you for listening.